Hello everyone and welcome back to Radiology Lens. In today's video, I'll be diving into the fascinating world of vascular imaging, specifically the ultrasound evaluation of plaque in common carotid artery. Ultrasound is a non-invasive real-time imaging technique that is invaluable in the evaluation of vascular health. The common carotid artery, one of the major vessels supplying blood to the brain, is a key area where plaque formation can indicate the risk of stroke and other cardiovascular events. So let's start with this first image. Here you can see a cross-sectional view of the common carotid artery. Notice the echogenic area along the arterial wall. This is the plaque. It appears as a bright region compared to the surrounding tissue. Plaque buildup can vary in composition, sometimes appearing uniformly echogenic or heterogeneous, depending upon factors like calcification or lipid content. In this image, the plaque is well defined and it is seen along the posterior wall. Moving on to the second image, we have a longitudinal view of the common carotid artery. This perspective allows us to see the plaques extend along the vessel. Here you might notice how the plaque extends over a longer segment of the artery. In some cases, a long irregular plaque may suggest a higher risk of instability, which could lead to embolization. Look carefully at the vessel's contour and note any irregularities in the lumen that might be caused by the plaque. Now in this image of the common carotid artery, you can see that there are two plaques in the bulb of the common carotid artery, one on the anterior wall and one on the posterior wall. The plaque on the posterior wall is also extending into the internal carotid artery. To summarize, ultrasound is an essential tool in evaluating carotid artery plaque. By carefully analyzing these images, clinicians can make informed decisions about patient management and potentially prevent serious cerebrovascular events. Thank you for watching. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more educational content. If you have any questions or topics you'd like us to cover in future videos, leave a comment below. Until next time, stay curious and keep learning.